prone elbows and quadruped position. So you're gonna start out in the prone elbows, and then you're gonna use your core muscles and your upper extremity strength to push up on your hands. And in this position, you're gonna have a small base of support with a higher center of gravity. And the weight is gonna be borne through your elbows, down your wrists, and your hands. Some precautions and contraindications is scapular weakness in the serratus anterior, the traps, and the rhomboids. Shoulder pain or decreased range of motion. Upper extremity spasticity, which is usually seen in flexion, adduction, and internal rotation. Recent chest surgery or trauma to the chest, or cardiopulmonary impairment, and obviously you need to be able to maintain excessive lordosis. So if your patient cannot do that, so your patient begins in prone elbows, and then, like I said, they use their core and their upper extremity muscles to push up, and their lower extremity should be in full extension, resting on the supporting surface. And then when they move into the prone on hands position, their shoulders are in flexion, their wrists and fingers are in extension, their elbows are extended, and their forearms are pronated. The therapist should, if they're on the side, then they're going to have their hand over the pec muscles to add stabilization. And then if the supporting surface allows it, then the therapist would straddle the patient to add stability. But if it's not, then...
Okay, look, she really is just learning how to do this. So we're talking, you've got to get in here and go up. Like that.
I don't think I've ever been that far back before.
You see what I'm saying?
Low back pain is normal,
They just might get flagged on YouTube.
But she's really going to need that support to get in this position. So you're using your body to do that.
If we post this, Tracy will be here.
I know it's a lot different when the patient has impairment.
Yeah.
Like, make sure you understood, it requires a lot of strength.
Is it getting hot in here?
Okay.
Like the supporting surface doesn't allow you to do that. Then you'll be beside the patient and stability. So the facilitation and inhibition techniques, like Ali talked about, tapping on the triceps tendon, this will help facilitate elbow extension. And another one is application of pressure on the posterior pelvis, which causes more stretch in the hip flexors, which causes tone. Another one is joint approximation. So that's just going to be when they like shift more of their weight to their shoulders, so more weight is being borne on their elbows. And then a form of inhibition is slowly rocking back and forth between the hands. And some exercises would be the therapist standing in front, and they alternate tapping hands. Another one would be putting like different colors of paper in front and telling them to touch, like right on red, left on green. And then another one would be objects in front or beside the patient to help with them being able to move forward and laterally. This activity has useful functional implications for patients with paraplegia. It allows the patient to achieve hyperextension of both the hips and the lower back, and this can help put their spine in the right posture. This position also provides patients with a bilateral knee foot ankle orthosis with a wider range of functional limitation. The prone hands position is important during the transition from floor to stand. It allows the patient to position both their body and their crutches correctly before initiating the standing process. And moving anteriorly and laterally will help.
Okay, because what if Libby fails, she has a spinal cord injury, what's she gonna do then? So she's gonna have to come all the way here. She's gonna have to come here. and then get up from there.
Right.
So that is one of the most important positions.
Alright. That's all I got.